Today I'm going to go over 4 of the most common pediatric rashes. Many of you, actually 85,000 of you, have watched this video I made about rashes in February 2020. Why did I make it? Because I thought that answering some of the most common questions that I get as a GP would be helpful to a lot of you. Always remember that these videos are not intended to replace medical advice, but are simply to be used as a source of information. The first of the most common rashes we see in the pediatric population that is under 18 years old and mostly under 5 years old, starting with fifth disease, or what is otherwise known as slap cheek. Fifth disease is a viral infection and it's caused by parvovirus B19. It most commonly affects school-aged children and they're most generally contagious 1 to 5 days prior to developing that rash. How does it present in most healthy children? In most healthy children, the initial symptoms are those of a typical virus: fever, sore throat, headache, but this is only about half of children. 25% of children will only have the typical rash and the other 25% will be completely asymptomatic. 2 to 5 days after the fever, the typical malar rash or slap cheek appears. This viral rash will typically then spread to the trunk and arms symmetrically in a reticulated pattern and is blanchable, meaning if you press on it, it disappears. Know that this virus occasionally presents with joint pain only, and that is called arthralgia. Of note, this virus could occur in adults, but is a lot more rare and is a threat to fetuses. So people who have this virus should not be in contact with anybody who is pregnant. That is why if you're pregnant, this is one of the first blood tests done in a pregnant woman in order to determine whether she is immune to parvovirus B19 or not. Finally, how do we manage the fifth disease? Conservatively, meaning we manage the symptoms like fever or runny nose. That means with Tylenol, Advil, rest, and nasal irrigation. I have a whole video describing how to provide nasal irrigation for your baby. Most children, though, will be completely healed by 2 to 3 weeks after the onset of their symptoms. Only rarely will more severe effects occur. So if you don't feel like your child is recovering adequately, make sure to seek medical attention. The second most common virus is the sixth disease, or roseola, another viral infection but is caused by herpes virus 6. It affects the little ones between 6 and 18 months old most often. Children who get this virus are only contagious during the time that they have the fever, not before. How does it present? By 3 to 5 days of fever and irritability that resolves abruptly and is followed by a rash 24 to 48 hours later. The rash usually starts on the neck and trunk and then spreads to the extremities. It's described as a maculopapular rash and it lasts only 3 days or less. Once again, for the treatment of this virus and the subsequent rash, it is simply symptomatic treatment, meaning treating the symptoms if they're bothersome. The next rash that I'm going to talk about is the famous hand, foot, mouth disease. This is caused most often by what is called Coxsackie virus. It most often affects preschool and school-age children. The child is contagious during the 7 days following the onset of the rash. How does it present? Generally, there's no prodrome, that is fever, irritability, etc. But it could occur in some cases. Most often, your child will complain of mouth or throat pain or just refuse to eat if they're not verbal. If there is a fever, it's generally low grade, that's below 38.5 degrees Celsius. Most typical rash presents as oral lesions. We call this an oral enanthem on the gum, the tongue, and the inside lining of the cheeks. They are small red circles and we call them macules. They progress to vesicles, which are small fluid-filled bumps that later progress to ulcers. No wonder they don't want to eat. But there's also an exanthem, that is a rash on the outside surfaces of our skin. It is either macular, that's small red spots, or vesicles, that is fluid-filled lesions that then burst. The rash resolves within 3 to 4 days. You'll find this rash on your child's hand, feet, buttocks, legs, and arms. So it's funny that it's called hand, foot, mouth when evidently it most commonly touches much more areas than just that. The child is typically completely healed within 7 days of the onset of the rash. The treatment? Once again, symptomatic. I know you all love photos and Google is not always the most reliable, so I'm gonna link a website in the description that is reliable and that I commonly refer to in order for you to be able to review the rashes yourself. You can type up the name of any skin rash and find the pictures to match it. Finally, a non-viral rash, but possibly the most common one I see in practice, eczema or atopic dermatitis. Eczema is a chronic, itchy, inflammatory skin condition. It's actually the most common inflammatory skin condition in the entire world. It occurs mostly in children, but also affects adults. Children, depending on their age, will present differently. If you watch this video, you can actually see the full breakdown on how it presents in infants versus toddlers. If you want a video on diaper rashes and what to do about it, let me know in the comments below. Follow for more ways on how you can live your best life possible.